and just drop your arms off the sides. Perfect. Just like that. A little tight in some of these spots. Any pain here?
No.
Here?
No, it just feels like tense.
Yeah, just a little tender and tight. Okay. Leave your belly as loose as you can. Give you a little twist and a little push.
Oh my god. That feels so good.
Felt good?
Oh my god. Yeah.
Good, I'm gonna lift you up.
Oh wow.
Feel like you can breathe a little better?
Yeah, I needed that.
Okay, let's have you lay on your back now. Perfect. And then scoot down just a little bit. There we go. Okay. Good. Big breath in. Out. Good. Loose shoulders.
Oh wow.
Good.
I felt
One more. Okay. I think we got most of that from face down.
yeah.
Okay, so now let's have you lay on your side. You'll face me over here.
Like this?
Yeah. Okay, let's bring this hip forward a little bit. So scooch towards me. Yeah, perfect. Just like that. Good. So my hand's gonna go right here on this kind of butt bone there. Okay. Big breath in. Out. Good. Pretty good there?
Yeah.
Okay, other side. Good. This is gonna be the same kind of thing. So let's bring that hip forward a little. Good. And right there. Big breath in. Out. Good. Doing all right?
Yeah.
Okay. I'm gonna take this pillow from you, and then we're gonna do your actual hips here.
Oh.
And then one more here.
Oh. I needed that.
Kind of crazy, huh?
Oh my god, yeah.
Okay. Let's scoot you up a bit now. And then we're gonna get into your jaw.
Can you feel like this?
Yeah.
You can feel that?
Yeah, you're kicking out over on this side. So open slowly, and then close. Open, close. Yeah, we're really kicking out over here. So we need to kind of even that up a little bit and try and get that joint to calm down. So what we're gonna do is we're gonna put your head on this pillow here. I'll have you lift your head up. Perfect. Okay, so this one's gonna be a little kind of fast. But what we're gonna do is we're gonna turn your head to the side here. Good, and you're gonna open your jaw, just like that. And I wanna have you kind of relax with that. Perfect. So we're gonna go right here. Good.
Oh.
Good.
Okay. That was
Doing
good.
okay?
Yeah.
All right, and then we're gonna go to this side. Good, loose. Good.
Oh my god.
Doing okay?
Mm-hmm.
Yeah. It looks a little crazier than it feels. So open, good. There it is.
Oh my god. Oh my god. Wow.
Ready for the other side?
Mm-hmm.
Okay. Good, loose. A little better. So that's one that we're going to kind of keep revisiting as we keep working with you. And then let's go ahead and decompress you, and then we'll be all set for the day. So.
I feel like I've been needing that for years.
Yeah. Okay, perfect. Right here and right here. Big breath in. Out. Loose. Good.
Feels so good.
Feel good? Okay, so we're
I
gonna.
feel like I've said that so many times.
Oh, it's okay.
Oh.
So we'll have you have a seat back over there, and let's see how everything feels now compared to before.
Yeah, it feels so good.
Yeah,
I feel like I've been needing all of that.
the jaw and everything especially. Yeah.
Yeah. Oh yeah, the jaw. I mean, I've had it for like years now, but I just never did anything.
Yeah.
I mean, I thought I would need like surgery or something, so I just never
No.
even looked into it.
Yeah.
Yeah.
Usually we don't have to do surgery or anything like that for stuff like this. Usually it just takes a little bit to get that joint moving, and a lot of those symptoms come right down.
Yeah.
And how's that back and neck?
Oh, yeah, it feels so nice.
Good.
Oh my god, yeah.
All right.
It just feels like it was like kind of pulled apart.
Yeah.
I don't know.
Decompress, a little bit more open.
Yeah.
Cool. Well, pleasure to help you.
Thank you so much.
Are you happy with your experience here today? Good.
I've been needing that.
Good. Well, you know, everything moved pretty well. I think you're going to do really great. Probably what we would do for this is what I'd recommend is see you like once a week for 4 to 8 weeks, somewhere in that time period. And then what I try and do is I try and get my patients down to just like once a month as quickly as possible. But what I've noticed is if we start it once a month, we do this like 1 step forward, 1 step back type thing, where every time you come see me, we're right back where we started.
Yeah.
So in the beginning, if we can be a little bit more consistent, we can actually make some progress and get you out of this, and then we can taper back safely and you won't feel worse once we stop treating you.
Okay.
So roughly 4 to 8 weeks of weekly, and during that time period, you're gonna come in sometime and you're gonna be like, hey, I still feel great from last time. Cool. We'll try a 2-week follow-up. You still feel great at 2 weeks, we'll try a 3-week follow-up. You still feel great at 3 weeks, we'll try a 1 month follow-up. If you still feel great, just once a month, just to keep things moving well and keep you feeling good.
Okay, sounds good. And do you think after this, do you think the jaws, it might pop a bit more? Or
You
you
may
think...
get a little bit more popping for a
But it's
while.
normal.
Yeah, and then sometimes what happens is that just starts to go away. But what you should notice is that the popping is usually not as painful or as uncomfortable as it was before.
Yeah, because it would be uncomfortable. Like whenever I would eat, I would sometimes have to stop because it would just like hurt so much.
Yeah.
But
And sometimes what happens is patients, you have something that's popping all the time, and then all of a sudden it stops popping and it's very uncomfortable. And the reason is because it's gotten so tight that now it can't even move.
I think that's what had happened because they had like stopped popping, and I was like, is this normal or what? But I know it was off though.
Yeah. And now that we adjusted it, you saw like we opened your jaw.
I noticed that all this side, I feel like it's not straight like it's supposed to.
Yeah, I feel a little out of whack.
The weapon, like,
Yeah.
like this. And
Oh, are you a veteran?
in different country.
Okay, gotcha.
Yeah, in Israel.
Gotcha.
I did the army for 2 years.
Okay.
So the weapon it sits like this. System that it's like
Pulling on you.
yeah.
Okay.
And I work out almost every day, and I eat healthy, and I'm trying to be very like, but I still feel it.
Yeah. Just feel a little out of whack.
Yes, and lately it's like got worse.
Okay.
Like I literally feel like I'm not straight. Like I can go.
You feel compressed.
Yes.
Yeah. Okay. And let me have you stand up for me, and you're gonna reach down, touch your toes as far as you can. Okay. And then come on up and bend backwards as far as you can. Okay. Does that hurt?
A little bit.
A little bit. Where is it uncomfortable?
Here.
Right across there. Okay. Okay. So let's see what's going on here. What we'll do is we'll have you come on over here. You're going to go face down. Your face will go right here where the paper is. There's a little handle right there that you can grab onto. And let me have you scoot down just a little bit. Right there. Is that comfortable for you?
Yes.
Okay. So if I press here, do you have any pain?
No.
Okay. What about here?
And it's not pain. That's not.
Just discomfort?
Yeah.
Yeah, okay. A little bit tight right there too. Okay, so we're gonna start here with your upper back and then we'll move our way around, okay? I'm gonna give you a little push and I'm gonna turn your head to the side. So keep your neck nice and loose. Good.
Oh my gosh.
Felt good?
Okay.
Surprising?
Yes.
Okay. One more, we're gonna go here. Good. All right, right here. My hand's gonna go under your hip, and then just relax your belly. A little push. Good. Okay, same thing here. Good. Let's have you lay on your back for me now. How are we feeling?
I feel like I'm in shock.
In shock.
Wow.
Okay, scoot up towards me a little bit. Perfect. Right there. All right, nice and easy. Good. How do we feel?
Whew. It's not painful, just
Surprising.
yes.
Kind of fast.
my gosh.
Okay. Well, we're going to decompress you a little bit. So let's have you lift your head up for me and then set it down. Perfect. Now if I pull here, do you have any pain or that feels okay?
Pain.
Where do you feel the pain?
I think here,
In the
like in
neck.
here. And here.
Okay.
It's a little bit like, I don't know. For me, it's fine. I can live with it, but it's painful.
Okay. I'm going to go here. I'm going to give you a little
Oh,
test
God.
pull and tell me if anything hurts, okay? So is this painful or that feels okay?
Painful a little bit
A little
here.
bit
It's like
painful.
pushing.
Does it feel like pressure?
Yes.
Okay. All right, so take a deep breath in for me. We're going to give you a little pull. There we go.
Wow.
How'd that feel?
Amazing. Wow.
Not painful, right?
No.
Like everything opened up, right?
Yes, like I felt moving.
Yeah.
Oh gosh, I love it. Okay.
Okay.
Wow.
So now let's take a look at your hips. Your
Yes.
pelvis first, and then your hips on the outside will be next, okay? Go in. So your head will go right there. Perfect. So your bottom leg is going to be straight. Top leg is going to be bent. Good. We're going to go right here and right here. Perfect. That okay for you?
Yes.
Okay. So we're going to adjust right here. Deep breath. Out.
Wow. I was going to break something.
No, you're not
Oh
going to.
god.
Okay, let's roll to the other side.
I don't know why I waited so many years. What
Yeah.
the heck? Okay.
You could have been feeling this good a long time ago.
Oh god.
Good. And right there. Breathe in. Good. Good.
Oh, yes.
Needed this, huh?
Definitely.
Let's have you lay on your back now. Second, I don't want this to grab your shoulder. There you go. Okay. So we're going to adjust your hip joint here. Let's see here. Yeah, okay. So let's drop this leg down. Perfect. Okay.
It's like I'm scared, but then it's fine. So
And then
I'm
it's
not
over.
scared. Okay. You can feel the difference, right?
Yeah, this one's tighter. It feels like. Good. Okay. So let's set you up.
Oh my gosh. Okay.
How do we feel?
Good. I feel like this area, like, not painful, I just feel like,
Feel a little sore
Yeah.
from twisting you? Yeah.
but it's fine.
Okay. Let's have you go face down. We'll do a little bit of massage gun to help that area calm down.
Okay.
This will help with that. A little bit tight. Yeah. Okay, one more thing here. Oh, you can stay right where you are. Doing okay?
Yes.
All right. Good. Okay, and that should help a little bit with the soreness. So let's have you hop up and see how that feels. Better?
Yes.
Good.
You got to see that this area it's different from here, like this more.
Yeah, a little bit
sore.
more spasmed up.
Right?
Yeah. Oh.
No, but it's better.
Good.
Definitely better.
So let's try a couple of those movements again and see how everything feels by comparison. So we'll have you stand here again and do your toe touch. Better?
Before it was like this, now it's like...
Yeah, all the way
I
down.
like it more.
And we'll have you bend back as far as you can. Good. That's way further than you were doing before. And then go ahead and have a seat and let's take a look at your neck. So you go chin down to your chest again. Good. Look up to the ceiling back as far as you can. And then over your right shoulder and your left. And how's that feel? I know your neck was bothering you. Better?
Like
Yeah.
when I do like this, it's like nothing push it like
Yeah.
crazy.
You don't feel as compressed as you did before. So tell me a little bit about like what's going on, what brings you in.
Okay, so I've never been to a chiropractor, so
Okay.
I'm like super nervous.
Okay.
But
Well, if you've never been to the chiropractor before, I'm very excited for you because patients are usually surprised at how much better they feel. So the process here, we'll kind of talk a little bit more about like how it hurts and exactly where it hurts, get through each step of the way, and I won't surprise you with anything. I'll tell you what we're going to do before we do it. So the pain and the stiffness that you're feeling in your neck, is that more of just kind of like a dull, achy, tight, or would you say it's more sharp or burning?
no, not necessarily. I mean, sometimes that has happened, but it's kind of just dull. Like it's just always there. I notice it's like tight, right back.
Kind of like a pulling sensation, just stiffness. Okay. And you're not getting any like numbness or tingling going down into your arms and hands?
Not recently, but it has happened to me before,
Okay.
where I get like these last two fingers for some reason get numb.
Start going numb?
Yeah.
Okay.
Okay.
It's good that it's not here now because that means that it's not as bad as it was.
Yeah.
But we'll kind of take a look and see what's going on there.
Okay.
The mid back, does that also feel kind of the same, like dull, achy, and tight, or is that more sharp?
I don't know.
Okay.
Like I haven't gone to work right now, so it's
Yeah.
like I'm okay right now. But like I feel like Saturday, it's kind of like burning almost. Like I'm like,
Okay.
oh, like my back hurts, and I keep saying it, saying it, but it's like right in the middle, kind of like.
Does the burning go up and down your back, or does it go
No, but it's
across?
side to
Yeah. And then the low back, tell me about that.
Yeah, I mean that is just random.
Okay.
I literally don't know. Like I think that has to be from working out for sure because, I mean, just certain times
Just stiff,
that I'll go.
tight.
Yeah, it
Okay.
just kind of.
So let's just start by doing this. We'll see how well you're moving,
Okay.
and then we'll check your spine out. So let's have you sit up nice and tall for me. You're gonna bring your chin down to your chest as far as you can. Okay, not too bad. And let's have you look up to the ceiling back as far as you can. Okay, and then come back to the middle. Look over your right shoulder as far as you can. Is that as far as you go? Okay.
Yeah.
And then look over your left. Okay, so we're a little bit stiff to the right. We're not turning to the right quite as well. You're gonna reach down, touch your toes as far as you can. Okay, not too bad. And then come on up. You're gonna put your hands in your low back and bend backwards as far as you can. Okay, so we're definitely bending backwards better than we are bending forwards. So let's see if we can figure out exactly what's going on. So what we'll do is we'll have you come on over here. You'll go face down. Your face will go right here where the paper is. And there's a little handle right there that you can grab onto.
Okay.
And let me scoot you down just a little bit, a little more. Right there. Okay. Everything comfortable for you?
Yeah.
All right, so the burning you usually feel
Yeah.
in this area?
Mhm.
Okay. When I press in here, are you getting any of that?
No, it's just kind of like tight.
Tight, okay. So we definitely have a little bit going on with this rib. This feels kind of stuck. So that's probably playing a role. Pretty tight up here too. Okay. A little bit here. Yeah. Is that tender there?
Yeah, like that hurts.
Yeah, okay. So definitely there at the base of the neck. Low back here, do we have any pain if I go here?
A little bit.
Okay, what about here?
Not as much.
Not as bad. And what about here in the center?
No.
Okay, so mostly kind of right side. And then what about here?
No, not really.
Okay. We'll take a look at your neck. Okay, yeah, we're pretty stiff on this right side. Yeah. Tender right in there?
Yeah.
Okay. So we'll probably start with that. So I'll kind of walk you through it here. So what I'm going to do is I'm going to lift you up and turn you.
Okay.
And I'm going to put my hand there and we'll kind of guide you through the adjustment. So we're going to go in here, there. So I'm going to lift you up just like this and we're going to go right here, okay? I'll just have all the way to your head. It's going to be fast. It's kind of already popped there. It won't hurt though, okay?
Okay. Oh my god.
Okay. What do we think of that?
That was so loud. I was not expecting that.
Yeah. Especially the neck because it's like right by your ears.
Yeah.
So doing okay?
Yeah.
Surprising?
Yeah.
Okay. All right, we're gonna come over to this other side. A little bit higher up on this side, so we're gonna go right here. Good.
Oh my god.
Okay,
Okay,
how are we doing?
good.
You still wiggle your toes?
Yeah.
Good. Down a little bit more. Perfect. Okay, so we're gonna do some of the upper back and ribs here.
Okay.
So we're gonna cross your arms just like this. I'm gonna roll you. My hand's gonna go underneath you. Okay.
Okay.
So roll you. Yeah. Okay. So you're gonna take a big breath in, blow it all out. I'm gonna kind of squish you here. Relax your shoulders. Good. Not too bad, right?
No.
Okay. All right. Breathe in. Out. Good. Okay. Well, that was that mid back.
Yeah.
I'm gonna try one more, a little lower.
Okay.
Breathe in. Out. Good. Loose belly. Okay. Perfect. All right. How are we feeling?
Better, I guess.
Okay. Okay. So. Pretty good through there. This may still. We're gonna try one more thing for that.
Okay.
So my hand's gonna go under your hip here, okay?
Okay.
And then I just want you to try and keep your belly loose for me. I'm gonna give you a little push right on that rib. There we go. Okay. Doing good? Needing a little bit more. And this right here too, so. Okay, so I'm gonna go right here. Now you're gonna turn your face to the right and lay your head flat. Perfect. I'm gonna kind of pull your hair out of the way. There we go. Okay. I'm gonna reposition you here just like that. Okay. And let your shoulders relax. I'm gonna give you a little push here, okay?
Okay.
Okay. Not too much. Okay. Back to the center. We got most of that. We may do a little decompression with you, but let's move on to your low back now.
Okay.
So lay on your side, you're gonna face me, and I'm gonna lift this up for you. This will be like a little shelf for your head. Perfect. So your bottom leg's gonna be straight, top leg's gonna be bent, just like that. I'm gonna pull you off this arm a little bit, and this will go right here on your belly. This arm will go overhead. That okay for you?
Yeah.
Okay. So this is for your lower back. So deep breath in and out. Good, loose belly, popping already.
Oh, shit.
Perfect. How you doing?
Oh my gosh. I don't know why I didn't expect it to be so like hard.
Yeah, a little bit kind of forceful. All right, so this one is gonna be for this joint here between your hip bone and your tailbone.
Okay.
I'll pull you off your arm a little bit. Good, this will go on your belly, this one goes overhead, just like that. Doing okay there?
Yeah.
Okay, so similar but different. Out. Good. Perfect. Doing good?
Yes.
Okay, so we'll have you lay flat on your back now.
Okay.
I'm gonna drop this down a little bit. Okay, for me. Perfect. Let me pull your hair out. Good. Okay. So if I give you just a little pull here, no pain, right?
No.
Okay. So we're gonna give you a little pull, nothing too crazy. Good. Okay, deep breath in. Out. Yep. So what that does is it goes through and it decompresses each joint and it'll go down. Because I could feel how stiff that base of your neck was.
Yeah.
And it didn't really work when we turned your head to the side.
Yeah.
So it just kind of opens everything up.
Yeah.
So, and then let's sit you up and see how you feel. Loose. Okay, so let's repeat some of those motions and see kind of how you're moving now. So we'll have you stand here and do your toe touch. A little better. How's that feel?
I mean, good.
Good. And then come on up and bend backwards. Good. Okay. And then so let's have you have a seat and we'll take a look at some of those neck movements. So go ahead, bring your chin down to your chest as far as you can. Much better, yeah. And then look up to the ceiling as far as you can. Good. Over your right shoulder and then over your left. Okay. So It's better. We're still not quite even in terms of turning to the right
Yeah.
with the left, but how does the neck and everything feel to you?
Good.
Yeah.
Yeah, this side kind of like hurts a little bit, but.
Okay, you feel a little bit sore?
Yeah.
Okay, we can work on the muscle for a little bit to calm that down. Sometimes after your first adjustment, you can be a little bit sore.
Yeah.
So let's see if we can get that muscle to calm down a little bit. Kind of all through here.
Mm-hmm.
Good. Okay. I'm going to use a little cloth here that'll help me do some massage on your neck. Okay. That okay?
Mm-hmm.
Good. Okay. Sometimes just a little bit of muscle work can make that feel a lot better. How's that feel now?
Yeah, I mean, it feels good.
Good.
Yeah.
Okay. All right. So you can be a little bit sore after your first adjustment.
Okay.
So if you are, it's okay to take a little bit of ibuprofen or use like a hot pack or take like a hot shower, hot bath. That'll help relax the muscles.
Okay.
And generally what happens is as people come in and keep getting adjusted after your second or third adjustment, you're usually not sore anymore.
Okay.
And so the soreness from your first adjustment can last anywhere from 12 to 24 hours, and then it usually goes away.
Cool.
So if you are sore, that's a little bit normal for your first adjustment.
Okay.
But overall, what do you think of the experience?
I like it,
Yeah.
I mean, it wasn't as scary as I thought it was going to be.
Yeah.
Especially the neck part. Like, I've literally never even popped my neck.
Oh, you've never even popped your
No.
neck on your own? Yeah.
Never. I can't. I don't know how to do it.
Yeah.
I mean, I wish I could because
Right.
I feel like I would feel better. But yeah, I've never even popped my neck on my own. So.
It's a little bit unnerving, and it definitely, I feel like people get that idea in their head of like, you know, people killing people in movies, and it's
Yeah.
not like that at all. So, okay. Well, you don't have anything too crazy going on. Your neck was definitely pretty tight.
Yeah.
After that decompression, that's going to loosen up a lot. I think
Yeah.
you're going to have a lot less of that, like waking up feeling awful. But I would probably recommend something along the lines of like twice a month for a couple of months, so
Yeah.
like every other week. And we'll start getting in there, getting you adjusted and loosening everything up.
Cool.
So,
I want you to bring your chin to your chest and go all the way back. Okay, look straight. I want you to turn your head the other way. Okay, do you notice it's easier to go that way than that way?
A little bit, yeah.
Right? Okay, now go to the side. Slowly, slowly. Yeah, so you're definitely more restricted going to the right. Okay, how about shoulders go all the way up for me? Go higher, all the way up. Okay, anything there, go down. And then how about to the side, go all the way up. Okay, and then can you do this? Can you touch the other way? One at a time, yeah. Okay, and then how about going behind?
Here feels tight, like when I do this.
Okay, how about on the right side? Can you go like that? And then the other way. Switch. Okay, your range of motion is pretty good in the shoulder. But let's check the tightness of the muscles here. Your traps are pretty tight.
Neck sometimes too.
Neck is a little stiff up there. We're checking mid-back. Yeah, you know, everything on your right side is tighter. You have trouble in that way, this way. Traps are tight, so your right side is stronger. Your right arm is more dominant. Body never lies. And let's check lower back. Lower back feels okay. Wow, your muscles, your erector muscles are very defined. Here, right there. You feel that?
I feel the bones.
No, we're not. This isn't bone.
Oh.
We're on the side. Your bone is right here in the middle,
okay.
right there. Right, we're on the sides here. There, you feel that?
Yep.
Let's get started. So I'm gonna have you do a lot of motions and movement. So starting off, we're gonna open up your traps here. Bam. You feel that?
Here, I feel like it doesn't keep going.
Yeah. Do you work out like your traps? Like, do you do like shrugs or something?
Yeah.
Body never lies. Wait, how?
Because you're constantly
Why?
in like a pull-up position.
Oh, okay. You have like very strong traps. Like I rarely ever feel traps that feel like this. This is incredibly stiff.
Stiff.
Yeah, like feels like cement. I'm not even joking.
That's so good to hear.
Oh, wow. Wow. That barely did anything. I need to bring out the hammer. Actually, we might have to bring out the hammer. Do you feel that? What does that feel like?
It's like something is stuck in there.
Yeah.
Yeah, like a knot. Oh.
Is that tolerable?
Tolerable, yeah. Not comfortable.
No, one more. One more right there.
Here is not bad. I feel like it's like a little bit more. Yeah, here is really painful.
Oh, that actually worked. Yeah, way better. I'm gonna have you go like this, here, and then behind your back, like so. Go. Oh man, I'm about to break my thumbs. And up, and down, and up. Very good.
What is that?
What is what?
Do you hear the clack?
I do. It could be scar tissue.
Oh.
This side's worse, huh?
Yeah.
Yeah.
It's hard to go like all the way down, I feel like.
Do you just hang on a bar at all, ever?
Yeah.
How long can you hang for?
Not long, like 15, 20 seconds.
Okay, we gotta get that higher, okay? Get you up to a minute of hanging. All right, now let's do some adjustments. You're gonna put your hands behind your neck, interlock them. I'm gonna come back behind you, and then I'm gonna lean back, okay? So I'm gonna come like this. Elbows in, head up, and then just fall back for me.
Oh my god.
I'm gonna come up here, okay? Just relax.
I feel like the head is the scary part.
Really? You get it done though, right?
Yeah.
There. Are you good? I got it right there. Drop your left.
Ow!
Why do you say ow?
It's just unexpected.
There it is. That's better. Yeah, and then let it go. I got it. How you doing?
Good. This is a first.
It's a first? Okay, you ready? You're gonna feel a nice little stretch. Okay.
Oh,
How's that?
interesting.
Should feel like a good stretch, yeah? Breathe for me. Excellent. How you doing?
Good.
What What does it feel like to you?
This side seems tighter.
On the right, huh? Everything on your right. Do you feel a stretch though when I'm bringing you down?
I feel like the muscle there is really tight.
The left side?
Both sides.
Both sides? Yeah, here, right? Back, like that. Back and forth like that. Okay. Go. So we're getting into her glute medius, her hip stabilizers. Very tight. Imagine from doing all the pull work, requires these hips to lock in. And so this will probably feel maybe pretty tender, I imagine. Not gonna fall. Nice. Oh, wow. It's like lengthening in real time. Has anyone done this to you?
No.
Well, this is your psoas muscle. Say hi to your psoas. Very important muscle for your hip flexors. Very, very
Yeah,
important.
hip flexor always tight.
How is that? You,
I always focus only on like this part, but
Yeah.
not like the entire thing.
was that intense? Like it hurt so good.
5 to 6.
Yeah. Good.
I've done that one before, but usually it doesn't pop.
What?
Yeah.
Okay, so same thing here. You're going to kick your leg
Back.
back and forth, okay? Scoot back a little bit towards me because I'm going to support you like that. Go.
Oh. I had like a hamstring injury on the right, and then after that lasted like 2 years. After that, I feel like my right leg is just always
It's never
kind
been the
of,
same?
yeah.
What was the injury?
Just I was doing a pole move and I think I overstretched. Like it went out of the split went out of my range.
All right, here we go. So we're on your scalenes here. It's tight on everybody.
Okay.
But for you, it's probably more dancing related than life related. Although it can be both. I am feeling both actually. It might take a lot longer to get better, whereas we do all the soft tissue work. So ideally, they're coming in as needed for maintenance only. They're maintaining on their own.
Ow.
Now we're in the suboccipital muscles here. This all should feel like relieving. My favorite muscle, SCM.
Ah.
Best friends. I got it.
Ah. What is that?
It's a thing that goes over and we pull your head.
Yeah. Does my neck get longer?
You'll get taller, yeah. A little
Let's
bit.
do it.
Let's do it. So what I want you to do is your yoga breathing that you were doing this whole time. Yes. How does that feel on your face there? Is that okay?
Good.
Okay, good. And I want you to relax your tailbone, okay? And I want you to tell me when you're breathing, you feel it in your tailbone, okay? So go ahead. One more time. Good. A little pull right here. Wow, your forearms are really tight.
Yeah. I just always want to take them out and then I can squeeze them.
Oh, we should do the shockwave on you.
I've done that one too.
You've done shockwave? Do you like it?
Yeah. It's intense. Oh, this finger is a little injured.
Which one?
The small one.
Oh, what happened?
I don't know what happened. But like last week I couldn't bend it. So maybe just leave that one out.
You want me to work on it?
No. No, I think I like my finger was stuck behind me, like my body and the pole, and then I just like squeezed it too much. And it was swollen for a week.
Just doing a joint finger massage just really helps, like getting into the joints here. It's a little swollen.
Yeah.
first I want to do your elbow, wrist.
Yeah, this wrist is a little.
Thumb. Okay, here's your lats, right in here. Okay, let's check your range of motion.
Okay.
Yeah, and then go back. Oh. Oh.
Better, but still a little tight on this
Yes.
side, I think.
Yeah, definitely. I still see it, but definitely a lot better. Yeah, your neck still very tight in there. In there. So yeah, for someone like you, you'd have to come back a few more times, handful more times, and do the same thing. Loosen all this up. Your traps feel way looser, way better. All right, we forgot to check your shoulder range of motion. How is it?
Good.
How's everything today?
Good.
Was it
Great.
too painful? Was it?
No.
I had like a random crick in my neck, and from then I just could never figure out what was wrong with it. I have some lower back pain as well, but it's on the opposite side as my neck pain.
Okay.
So I don't know if there's a reason for that opposing force. So.
Okay. All right. So we've got neck, we've got glute,
little
we've got
zigzag.
hamstring. All right.
Yeah.
If you had to pick which one to get rid of completely, which one would you pick?
Probably the neck pain.
Touch your chin all the way down to your chest. Any stiffness or discomfort with that?
Yes.
Where?
It's through the back of my neck.
Okay. Look back as far as you can. Any discomfort there?
Same. Just
Same
the
place?
center more.
Okay. Keep your body neutral. Turn your head to the left as far as you can. Any discomfort there?
Through the right side.
And all the way on the right. And that's pretty stiff and limited.
Yeah.
So that
that's
same
the
discomfort.
Same spot.
All right, can you face the wall here? With your right arm, reach down the middle of your back as far as you can. Good, now the other side. Very good, now reach below as high. Any discomfort with those arm movements?
The one with my right arm behind my back, yeah.
Any discomfort there?
Just in that right hamstring.
The hammy. So put your hands over your head, lean back as far as you can. And what do you feel right there?
Not really anything.
Okay, face directly, feet together all the way. Twist to your right as far as you can until you're looking. Twist your hips and everything. Good. And now the left. Good. Any stiffness, discomfort?
To the right, it felt like it wasn't as loose to twist.
Okay. Feet about shoulder width apart. A little bit wider. Put your hands over your head. Go out as low as you can. Good. And coming up. Pain, stiffness, discomfort, anything?
No.
Okay. All right. So show me that one of the sit-ups or one of the poses that where you can really tell that your neck is bothering you.
Probably it kind of starts from here and it goes into, say I'm doing a full body sit-up. It's this first motion.
Okay.
So trying to keep my feet planted and coming up till about right there is where I feel it.
And you felt it just now.
Yeah, on that
Okay.
right side.
We'll flip around and show us a couple of push-ups.
So it's only if I'm doing like a wide bicep push-up
Okay.
and it's on the descent and going back up.
And you feel it in that neck area.
Yeah, and
Okay.
that one kind of spans like down the shoulder. a
Okay.
little bit.
Okay, so we went over Sierra's x-ray as well as her old examination forms. We did a little bit of a movement assessment and we saw there was definitely some limitation and strain with her neck movements, with her shoulder movements, and even some irritation and limitation with some of her rotational movements. So we're gonna go over all that sort of stuff and see what we can do to help her today. Okay, so I definitely feel some restrictions in your neck. I'd like to do a neck adjustment, okay? Are you comfortable with that?
Yes.
All right. All right, you ready?
Mm-hmm.
Good. You ready over here?
Yes.
Good. All right, so some muscle tests. You ready?
Okay.
So make a fist. What I'm going to do is push your elbow down, good, and resist just like that. But just stand your ground. You don't have to. You don't have to win.
Yeah.
Okay. Pushing down. Again. Not so good.
No.
Okay. Any discomfort there?
No.
All right. So that was the coracobrachialis muscle. All right. And the nerves that control that come out of your neck right here. So even though we already did a couple of neck adjustments, we want to get right on that segment and stimulate it, okay?
Okay.
Let that go. Okay. Make a fist, pushing down. A bit stronger, yeah?
Yeah.
Good. Now put your thumb and your pinky together. What I'm going to do is pull them apart. Don't let me do that. Come on. Not so great. Right there. Good. Thumb, pinky. Pulling apart. Not so great. Okay, relax. So sometimes when we don't get those muscles firing, indicates a little bit of an issue with the wrist or your fingers. Put your thumb and pinky together like this. Pulling apart. A little bit better, yeah?
Yeah.
Don't let me do that. Very strong. Great. Okay, make a fist. I'm going to push down. Don't let me. Go. Awesome. Hold it right there. I'm pushing out like that. Don't let me. Pushing that way. Don't let me. Really good. Relax. Make a fist. I'm going to push down. Don't let me. Pretty good. No irritation?
A little bit.
It was irritation.
Labrum area.
Yeah. Okay. Good. So what I'm going to do then is do a little adjustment. Because that's the coracobrachialis muscle, like I said. And so I'm going to adjust your AC joint. So let that go right here. Good. Make a fist. Pushing down. Good. Same irritation?
No.
Good. All right. Thumb and pinky. Pulling apart. Don't let me. Not so good.
No.
Okay. Yeah, definitely a little bit of stuff there. Good. Thumb, pinky. Pulling apart. Better, yeah?
Yes.
I'm going to pull that way with your elbow.
Okay.
Don't let me do that. Again. Not good, huh?
No.
All right, so my thumb goes in your armpit. I'm going to wrap my hand around your shoulder blade.
Okay.
And get all up in your grill here. We're going to adjust the rib cage underneath your shoulder blade. So I'm going to grab your elbow, you're going to relax it, and the adjustment's going to be down like that.
Okay.
Take a deep breath. Breathe out. Very good. That's funny. So relax. What I'm going to do is adjust where your clavicle meets your sternum right here so we can see if we can turn on these pec muscles that weren't firing. Good. Hold it right there. Pushing that way. Stronger, yeah?
Yeah.
Pushing that way. Very good. Okay. A couple other ones. Straighten your hand. I'm pulling towards me. Don't let me. Not great, right?
Yeah.
Did it hurt?
A little bit in that, kind of more to the back of the shoulder.
And what it's looking for is this bicipital tendon as it starts in the shoulder and goes down. Sometimes it gets a little stuck outside of its groove. So what I'm doing is putting it back in its groove, and I know it's very tender, right?
Yes.
Good. Straighten your hand, pulling towards me, don't let me. Again, did nothing. Okay. And it hurt pretty good too, still, right? Okay. Tell you what, straighten your hand. I'm going to push towards you. Don't let me. Good. Okay. Pushing down.
Oh.
Yeah, pretty
Yeah, that
painful.
one hurt really bad.
Okay, so I'm going to do an adjustment right here with the shoulder. So try to relax. Good. Hold it right there. Pushing down. Still not pretty good. Okay. Put your chin to your chest. Breathe out. Good. And a little bit more. Good. Hold it right there. Pushing down. A little bit better, yeah?
Yeah.
And I'm going to pull towards me. Don't let me.
Yeah.
Now that's firing. Good. We got that going. I'm going to do some muscle tests. I'm going to push down like so. Don't let me do that.
Okay.
Ready? Again. Pretty strong. Good. Pushing down. Don't let me. Ah. Not so good.
Yeah.
That hurt at all?
A little bit. I had a pop kind of in there.
All right. So your hip flexor tested weak. Your hip flexor is the nerve roots that come out of right there is what supports that. So I'm going to bring you over here. See if we can't press reset on it. And you are bendy, huh? Breathe out. Very good. Pushing down. Don't let me.
Oh, that's so better.
A little better, huh?
Yeah.
All right. Keep your legs together. I'm going to pull this leg towards me. Don't let me do that. Ready? Again. Not great. Go. Again. A little stronger.
Mm-hmm.
Not significantly, though. I want to check some other stuff. Pushing down and in. Again. Not great. Down and in. Again. Not great. Down. Don't let me. Ready? Again. Not so great. Pushing down. Don't let me. Really strong. All right, breathe out. Good. Oh no, it was the other one. Pushing down. Don't let me. Way better. Yes.
Yes.
Okay. Good. Now, which hamstring?
It's this one.
To exactly where it is.
It's kind of down the side right here, but
Okay.
more like in the back, like dead center.
Okay. All right. So what's going to happen is we're going to do a myofascial release with your glutes, probably your hamstrings. Come back. And again, go. Does this hurt further?
It hurts when I go further.
Where does it hurt in that
It's
spot?
kind of like there.
Okay, ready, go. Okay. Again. That's as far as you can go, huh?
Yeah.
Because if you go any further, it hurts.
Yeah.
Okay. Relax your second. I'm going to grab your hip flexors back to the start.
Okay.
Okay, start relaxed. Go for it. Good, and back to the start. Again, go. Okay, back to the start. Again, go. Where?
That is so painful.
Just the skin right there?
No, like that muscle.
Yeah. So I'm doing a little bit of what we call active release technique. And I'm feeling for where the tension is in your muscles.
That spot's very sensitive.
And that is
Yeah.
where it is. So I'm going to get in here with 2 thumbs, and I want you to straighten your knee all the way. Bent. And go. Okay, back up. And go. A little bit better, yeah?
Yeah.
Bend your left knee, straighten your arm. Good. Arm down by your side. Keep your teeth together. Touch your chin up to your chest. And down. And again.
I didn't feel anything.
Good. Give me 10. That first exercise where we had you laying on your back and you were kind of tucking to your chin, but you're holding the weight in the one side. What was that like for you?
Definitely a lot of strain in the right side at first, but
Okay.
once we kind of switched the hands and did the other side, I could see where it would build strength.
Yeah. So we turned them on first and then had you do that flexion pattern and suddenly there was way less discomfort, the range was pretty good, and we're able to start helping out. Back like Superman does. Hold it right there, and tuck your chin to your chest, all the way, and back to neutral. And down. Good. Does that hurt?
Not really, no.
Good. Switch arms and legs. Tuck your chin to your chest. Good. And back. No pain?
That one pulls a little bit on that right side of the neck.
Okay, good. Exercise, we kind of took it to the next level. So in a quadruped position, you have to control more of your body weight. So it's a little bit more difficult. And we found the right core engagement, and then put your chin to your chest. Moving you to the next level where it's a more functional sort of thing. From here. Okay, I'm going to push from here. I'm going to push from here. Good, now chin to chest. Good, 2 more. Last one. Good, okay, relax. You doing okay?
Yeah.
Okay, so that's our treatment.
Thank you.
Yeah, how did that go overall?
It went well. I definitely think those exercises will help with strengthening my weaker right side.
Yeah.
Yeah.
You know, we were able to address your neck, but I think with your lower back and your hips, and particularly that hamstring, we felt that knot in your the lateral head of your hamstrings. I think there's a little bit more work to do with you. So if you'd like to come back, we could certainly set that up for you. But thank you so much for being such a great patient. You were a great sport today. You can find Sierra at Pure Barre in Knoxville, as well as in
Artistic
Alcoa.
Dance Unlimited.
Artistic Dance Unlimited in Alcoa.
Prima di tornare a Milano mi ha detto che ha un po' di fastidi qui sul passaggio cervico-dorsale perché sta tanto tempo al lavoro, computer, cellulare.
Al telefono, sì.
Al telefono, quindi questo naturalmente comporta questo tipo di postura. E poi abbassando la testa automaticamente le spalle seguono e si chiudono, diciamo, protraendo del tutto la postura.
Tutto.
Ho detto tutto, c'è altro?
Tutto.
Se sa. Buono. Allora, vieni seduta, girata di là. Vediamo un pochino che cosa troviamo. Sì, fastidio qua?
No.
Di qua?
Nemmeno.
Ok.
Quasi piacevole.
Quasi piacevole?
Sì.
Di qua?
No.
Qua?
No.
C'è differenza fra i due?
Sì.
In che modo?
Qui sento un movimento strano.
Ok. Fastidio qui sotto?
No.
Qua?
Meno.
Meno, ok,
Sì.
quindi un po' più qua.
Sì.
Qui senti il movimento strano, mi hai
Sì.
detto. Se io premo qua, dove tu hai fastidio, scusami. Se io premo qua, il movimento strano c'è ancora?
No.
Sparisce. Quindi sappiamo che c'è un collegamento tra qua e qua. Vediamo come ti muovi. No, benone. Andiamo in estensione. Ecco, qui c'è un blocco sulla destra quando vai in estensione. Datti un abbraccio per favore. Perfetto. Perdonami. Sentiamo la colonna. Hai fastidio qua?
No.
Non sento grandi problemi, giusto qualche piccolo blocco, diciamo, normale. Una bomba. Andiamo di qua, scusami. Perfetto. Ok, pancia in aria con la testa qua. E adesso ci mettiamo alla ricerca del problema.
Vai.
Allora. Un secondo che...
Vai.
Sì, leggermente più corta gamba sinistra della destra, che ci torna col fastidio che sentivi tu dietro. Ma tu non sei mancina, giusto?
No.
Lascia. Sei sotto stress?
Ma non penso.
Okay. Perché qua i piedi, questo ruota tutto sommato bene, questo si ferma prima, vedi?
Sì.
Hai noia qui quando premo?
No.
Di qua?
Meno.
Meno, ok.
Sì.
Sull'esterno invece dovrebbe invertirsi, un po' più qua meno?
Sì.
Ok. Sull'inguine. Un po' qua? No?
Un po'.
Qua meno.
Qua meno.
Ok, e sul pettorale, questo già lo so perché fastidio qua?
Sì.
Qua meno. Quello che avevamo visto prima all'impiedi. Col ginocchio teso, dritto, spingi la gamba in su. Ok, spingi in su. Ok. Facciamo esattamente la stessa identica cosa. Spingi su. Spingi su. Ok, non posso usare questo muscolo ipertonico. Vediamo di qua. Spingi su. Stessa cosa. Fastidio?
No.
Ok. Bello, quindi facciamo le sinfonie. Gomiti dritti, spingi uno contro l'altro, vai. Ok, piega le gambe. Spingi. Qui va bene, gambe giù. Inspira e trattieni. Spingi. Butta fuori. Tieni fuori, spingi. Spingi. Non ce la fai quando butti l'aria fuori, eh? Ok. Questo si chiama expiration assist. Quindi dobbiamo risistemare il sistema cranio-sacrale per farti riacquisire la giusta funzionalità dei muscoli. Spingi su. Vai. 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 Ok, vedi qua perdi forza, però prendi aria. Trattieni, butta fuori. Tieni fuori, spingi. Senti come cambia?
Sì, è vero.
Abbastanza evidente. Apri. Inspira. Fuori. Eccolo qui. Inspira. Fuori. Inspira. Fuori. Inspira. Fuori. Ok. Ma vi devo passare di là, in realtà. Quindi di solito, ecco, infatti l'osso sacro lo vado così. Questa correzione sul bacino avviene così, rilassata, inspira. Fuori. Inspira. Fuori. Inspira. Fuori. Ok, torna a pancia in aria. Adesso, se sono stato bravo, prendi aria e butta fuori. Quando hai fatto la tieni fuori. Vai, spingi. Molto meglio. Giù. Spingi. Molto meglio, ok? 2 dita qua. Spingi su. Adesso questi non perdono forza quando tu tocchi là. Vuol dire che il tono è normale. Spingi su. E adesso posso mettermi alla ricerca. Se non sbaglio tu dovresti essere così. Spingi su. Spingi. Ce la fai, eh? Spingi.
In serio?
Ok. Poi mano piatta qua e 2 dita qua sotto. Spingi. Vedi quando funziona. Spingi. Quando funziona un sistema. Adesso vediamo qua. Questa giù. Spingi. No, a posto. Spingi. Ok. Questa è la sinistra, sì. Quindi andiamo così. Spingi su. No, spingi. Spingi. Qualcosina c'è anche qua. Un bel respiro. Tieni. Fuori. Testa dritta. Occhi chiusi. Un bel respiro. Fuori. Un altro. Fuori. Ok, vieni a pancia in aria.
Mi sdraio?
Sì, come prima. Faccio il test dopo averti corretta. Quindi metto un'interferenza elettromagnetica su di te. Spingi in dentro. Dimmi tu come lo senti. Meglio?
Sì.
Spingi. Sì, molto meglio.
Sì.
Adesso passiamo agli adjustment.
Ossia?
I crack.
Ah, ok.
Spingi fuori. Così, vai. Ok. Anche qua. Ok. Piega. Ti faccio mettere il palmo della mano qui sulla fossetta. Sai dove stanno le fossette di Venere? Vai, metti il palmo.
Questa?
Yes.
Ok.
Ci sei?
Sì.
Con la mano lì spingi fuori di nuovo. Gamba.
Ah, ok.
Spingi. Ce la fai.
No.
Il cambio. Invertiamo. Così dovrebbe. Spingi fuori. Questa tiene.
Sì, questa
ok.
sì.
D'accordo. Quindi sappiamo che il problema nasce là. Inizio da sotto però. Lascia. No, che a posto.
Bellissimo.
Questi sono... Lo sai che nessuno riesce a trattare i miei di piedi?
Perché?
Ci riesce nessuno. Non lo so, vorrei saperlo anch'io.
Non hai trovato uno bravo ancora. Per
No,
te.
i miei piedi sono difficili, sono molto difficili. Vediamo. Stringi. Stringi. Apriamo un po', dammi un dito. Lo metti qui. Spingi. Spingi. Meglio. Lascia. Ecco, già andato.
Sì.
Eccolo lì. Stringi di nuovo. Ok. Ok, anche tu hai una falange più corta a sinistra. Gira la testa a destra. No? Gira a sinistra. No? Testa in centro. Porta l'orecchio destro verso la spalla. Anzi no, l'orecchio sinistro verso la spalla sinistra. Così, come se stessi leggendo il telefono. Bravissima. L'altra parte. Testa indietro. Eccolo. Confermo quello che ho detto da seduta. Quando tu vai con la testa indietro abbiamo un problema qui. Quindi vado in posteriorità per correggere l'estensione. Lascia.
Oddio.
Sì, è andato bene, è andato particolarmente bene, direi.
Sono spaventata.
Adesso però sono uguali. Ok? Spingi? Sì, un po' sì, però cambia la direzione. Lascia. Lascia. Ok.
Lo sapevo.
Vai. Ok, mano qua. Lascia. Ecco, questo è andato.
Sì, questo
Sono
sì.
andate due. Stringi qui. No, qui va bene. Gambe sono pari. Ok. Guarda, hai i poggiabraccia sotto.
Ah, ok.
Ok. Fastidio qui?
No.
Sì, questo qua, in
Sì.
posteriorità anziché in lateralità.
Sì.
Un bel respiro. Fuori. Lascia. Eccola, questo non credo, però lo sentiamo. Un bel respiro. Fuori. Eccolo lì, invece c'era. Hai visto? Qua. Morbida. Ok, mobilizziamo un po' la cassa toracica. Adesso no, era qua. Quando mettevi la mano qua a pancia sopra perdevi la forza. Spingi su. Ok, perdonami. Spingi su. Rifaccio. Spingi su. Sì, confermo. Di qua invece spingi su. No, va bene. Ok, fianco destro per favore.
A quest'altro mi sa mi piace pure.
Mi sa pure a me,
Sì,
lo sai.
sì.
Ecco. È andato posteriore, è rotato così, quindi lo prendo da qua. È già andato. Ok, altro lato. Stupendo. Più avanti. Ok. Adesso dimmi qual è peggio. 1, 2, 3.
3.
3. Che sarebbe L3. Questa è rotata verso di me, rotazione destra. Quindi la prendo, l'aggiustamento avviene qui. Adesso però ti porto vicino e ti aggiusto. Ok. Pancia in aria.
Ma hai sentito? Cioè, è impressionante.
Adesso avevamo fatto questo?
No. Vai.
Su.
Io voglio.
Me lo dicono tutti.
No, vabbè. Come si chiama?
Theragun. Tradotto sarebbe la pistola della morte.
Ah,
Ah. Oddio.
Qui sotto lo senti un po', eh?
Sì, qua in mezzo, qua.
Sul passaggio dorso-lombare.
Sì.
Eccola là. Lascia. Questa è libera, infatti. Ok. Un paio di cosette. Dritto il gomito, spingi su. Mignolo dentro l'orecchio. Questo.
Qua.
Yes. Spingi. Va bene, dammi l'altro. Spingi. Mignolo dentro l'orecchio. Spingi. Ok, perdonami. Spingi. Vai. 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 Spingi leggermente prima. Eccolo lì. Riproviamo l'altro. Leggermente prima. No, prima piano piano, graduale. Adesso secco. Eccolo lì, è andato un po'.
Sì.
Quindi è tutta tecnica.
No, qui.
Facci vedere dove sulla schiena.
Tutta la colonna.
Ok, quindi non qua e non qua, ma solo qua.
No, anche in basso.
Anche in basso.
Dipende dai giorni.
Ok, e il fastidio rimane comunque circoscritto oppure irradia sulle gambe?
Sul ginocchio, perché
Sul
appunto
ginocchio.
ho un'anca più alta e una più bassa, quindi anche
Ok.
sul ginocchio sinistro.
Sinistro.
Esatto.
Perfetto. A parte questo ci sono altri disturbi, altri fastidi che lamenti?
A parte i mal di schiena, comunque soffro anche di cervicale da sempre, quindi...
Ok, quindi fastidi al collo.
Esatto,
Che
sì.
rimangono circoscritti anche loro o vengono nelle braccia?
No, rimangono al collo, non vanno sulle braccia.
Ok, perfetto. Allora, ok, perfetto. Guarda dritta. Adesso, prima cosa che vedo è che c'è un crollo dell'arco plantare a destra, quindi tendenza ad avere il piede piatto. Vediamo anche a sinistra, anche a sinistra. Allora, guarda dritta. Qui tu hai l'occipite leggermente più alto a sinistra. Aspetta. La spalla lievemente più alta a destra. Poi ovviamente qui c'è la scoliosi, quindi il busto è ruotato così. E il bacino è più alto. Certo. Ok. Allora, alla luce di quel che vedo, dovrei trovare fastidio qua, giusto? E qua?
Sì,
Quale è peggio, destra o sinistra?
sinistra.
Ok, lo stesso dovrebbe essere qua su. Fastidio qua? Qua?
Di meno.
Di meno. Se invece vengo al centro dovrebbe invertirsi, quindi più qua, qua meno.
Esatto, sì.
Ok, guarda dritta. La distribuzione del peso. Abbiamo 32 a sinistra, 24 a destra, 8 kg. È significativa. Quindi lei appoggia molto più peso sul lato sinistro. Trovato. Fastidio qua?
Sì.
Siamo su D7, quindi settima dorsale, terza lombare e dovremmo trovare anche la terza cervicale allora. Fastidio qua?
Sì.
Ok, ci siamo. Sdraiata a pancia in aria. Rilassata, non è una guerra, ok? Ti ho fatto male finora?
No.
Allora, hai fastidio qua?
Sì.
O è peggio questo?
Sinistra.
Peggio il sinistro, vero? Perché quella gamba di qua è più corta. Fastidio di qua? O peggio questo?
Peggio a destra.
Peggio a destra. Se invece vado qui sul bacino, dove hai la gamba più corta, dovresti avere fastidio qua. Qua meno.
Esatto, sì.
E però se vado sul pettorale, più qua, qua meno. Ti torna?
Sì.
Morbida? Eccolo. Lascia. Eccolo lì. Questa cicatrice?
No, il mio gatto.
Ah, il tuo gatto?
Sì.
Lascia. Fumantino il gatto. Mano qua. Rilassata. Perfetto. Lascia. Il gomito, lascia. Eccolo. Qui va bene. Mano qua. rilassata. Ok. Col sedere sul bordo.
Ok.
E la schiena appoggiata. È un po' freddo, ma ci si fa subito l'abitudine. Allora, questa è la terza cervicale che avevamo trovato. Non è rotazione. Ok. Stavo solamente palpando inside ed è andata. Rilassata. Devo dare, no. Appena ti muovo, scrocchi, lascia. Ecco. Ok, hai avuto dolore? Quando c'è l'occipite. Giù la spalla. Rilassata, rilassata. Lascia, morbida. Ok. Perfetto, fatto male? Abbiamo anche qui sotto una C6. Questa lasciamo morbida, faccio il movimento, lascia. Eccolo. Ok. Qui, settima dorsale. Lascia. Eccola là, sentita, sì? Qui possiamo vedere che l'osso sacro si è quasi orizzontalizzato, ok? Quindi prima di andare a aggiustarlo in modo tradizionale lo porto, ecco qua. Ok. Adesso fastidio qua? Anche qua, giusto? Però se io spingo qua, migliora questo? Ok, se invece faccio così? Qual è meglio? Questo o questo? Il secondo, l'osso sacro infatti. Qua. Lascia. Con la testa guarda il soffitto. Bravissima, non avrai dolore, lascia. Eccolo lì, mi sono solo dovuto appoggiare, torna a pancia sotto. Meglio? E si può anche vedere che il sacro adesso è meno orizzontalizzato, ma è tornato un po' più in posizione normale. Ok. Io qui sento un blocco sulla quinta vertebra dorsale, ma glielo lascio. Glielo lascio perché voglio prima le radiografie, prima di correggerlo. Avevamo una terza lombare, se non sbaglio. Questa qua. Che avevamo controllato col nervoscopio. Fastidio? Qua? Sì. Vieni sul lato destro. Vieni avanti col sedere. Poi attenzione, io le radiografie sue non è che non le ho mai viste, mi ha mandato una foto, quindi ho un'idea generale, però devo fare delle analisi, delle valutazioni molto molto precise sulla radiografia stessa per valutare la posizione di alcuni metameri, quindi di vertebre, segmenti vertebrali. Qua. Vediamo se riesco con le dita, così, una morbida, rilassata, questo, eccolo, sono riuscito, con 2 dita. Mary a 18 anni le è stato consigliato dal suo ortopedico, giusto? Di portare il busto. Solo che lei non riesce a portarlo, non riesce a metterlo e quindi fa un po' di fatica. Vediamo se riusciamo noi a essere d'aiuto in qualche modo. Questa mano qua dietro, rilassata. Ok, l'altra. Ok, giù. Adesso vieni in piedi, mani sui fianchi, girata verso di lui. No, a metà. Spingi il tuo gomito rapidamente indietro. No, non la spalla, non devi fare questo. Guarda me. Tac, veloce, hai sentito? È scrocchiata anche la mia. Te do io il via. Via. No, fai sempre la spalla. Spalla ferma, è così. Tac.
Ok.
Vai. Non ce la fai, non c'è problema. Vediamo di là. Lascia. Vai. Veloce. Ecco qua. Ok, perfetto.
No, mi sento più leggera.
Più leggera?
Esatto, sì.
In termini di allineamento, noti differenze?
Per ora così e così.
No, vabbè, ci credo, senza radiografie ero mago Merlino se ci riuscivo. Allora, il dolore invece sotto?
No,
Non ce l'hai?
no.
Ok, perfetto. Allora, per oggi mi fermo qui.
In like a sentence, what is that?
I test intellectually disabled people and find out what part of the brain is not functioning. And then that gives the neuropsychologists ways of how they're going to help the person.
And what type of major were you in college to do something like that?
Neuroscience.
Yeah.
Experimental psychology, yes.
Here in Manhattan?
Yes.
Where?
New York University.
Interesting. Okay, so what do you want to work on today?
Lower back, buttocks, and ankles.
Okay, what part of your lower back? Is it lower left, lower right, center?
It's usually the whole lower back.
Okay. So you said usually your left ankle.
Yes.
Okay. What type of exercise do you do? Are you
Lately, I haven't been doing any exercises
Okay.
because I just have gotten like chronically fatigued.
Okay.
So.
All right, well, let's start with body stuff today.
Okay.
And I'm going to have you put your nose back in the paper, straighten out your body on the table, come back a little bit, perfect. Let your feet relax,
Okay.
nose down, arms alongside your body. And I'm going to put these little adjusting or alignment shoes on your feet. Relax your feet right now so that they just stay loose and relaxed and supple. So I can move them around a little bit. And these alignment shoes allow me to see if there's any imbalances. So the first thing I noticed is your left leg's pulling short. Not a lot, like a centimeter or a little less than a centimeter, but it's a clue, nothing more than a clue. Let me carry the legs myself so that I really just see them loosey-goosey. And I bring them down, I look at them one more time, and it's definitely the left leg. I would say it's just about a centimeter short. When I bring it up to the second position at 90 degrees, they even. So when they even like that, sometimes there's knee involvement. Actually, I saw something here. Do you feel a little tenderness here on the inside of the knee?
Yeah.
Do you ever get that?
Yeah.
I'm going to adjust it down. And wait, there, I missed it. Do you feel it right there?
Yeah.
That was tender, right?
Yeah.
And I'm going to come into the medial ankle and adjust from medial to lateral. The legs are even already.
Wow.
So let me bring them to position 2, position 3. I'm going to pull down on the left hip. The legs stay even. I'm going to push up on the left hip. The legs stay even. I'm going to push up on the right hip. The legs stay even. I'm going to pull down on the right hip. The legs stay even. So far so good. Squeeze your knees together, which checks and relax, which checks the pubic bone. Actually, I saw a little shortening pattern. Let me push down on the opposite hip. That should do it. I can adjust the pubic bone on the anterior side, but sometimes I can catch it from the pelvis side or the back, the posterior side. Squeeze the knees together to repeat the test and relax. The legs stayed even, so we're good there. I'm going to check for hip rotation and external rotation, and that all looks good. Yeah, so the ankles are off. We're going to do that in a minute when she's lying supine because it's hard to get the ankle face down with these shoes on. Let's try something different. Take this leg, lift it as straight as possible like this, and then put it down. Do that by yourself. And then, did you get any pain, tension, or restriction doing that?
Yeah, like here.
That whole side, right? Then do this leg and tell me which one's harder to lift.
This one.
Definitely that one?
Mm-hmm.
So let me take these shoes off of you. And go back to lifting that side again, but this time when you're lifting, stick your thumb or finger into the bad spot. Use one finger so I can tell. All right, I'm going to put my own thumb there. Drop your leg and lift again, and let me see if I can feel it. Okay, I can feel it. Can you?
Yeah.
It kills, right?
Yeah.
So I'm going to just do this. Drop your head. I'm going to do a few of these in here with the adjusting instrument. And repeat that test.
So much looser.
Much looser?
Yeah, but still.
But still,
tight.
then let's keep working, okay? So right here is a good spot.
Tender, yeah.
And now try it again.
Much looser.
But where is it still showing up?
There.
All right, so I'm going to come a little closer. Now I'm very close to the bottom of the sacrum. This would be the cornu of coccyx, or the top, because you could feel a little. The coccyx has these like little horns on them, and like cornucopia, the corn or Latin for horns. So the coccyx, or the tailbone, has these little kind of bumps, and you can palpate and feel those quite easily. So it's just above it, about 1 centimeter above. I'm slightly right of center. I'm going to get a good contact point. I'm going to come straight down.
Still a little tight here.
Okay, after that big buildup, I didn't fix it, huh?
I'm sorry. Right
It's
there.
okay.
Right
I
there.
sounded good, kind of, right, for like 2 seconds. It's like, oh, this guy knows what he's talking about.
He does.
But then he doesn't do shit. He doesn't even help me. He sucks, but he like talks a good game. Okay, so try it now.
Yeah.
Yeah, what?
It's looser. It's this button.
All right, I give up. Get out of here. Let's get me someone else.
I'm sorry.
No, I'm joking. I'm joking. You bend this knee up like this,
Okay.
and drive that up a little bit.
Ow,
So I think you got some. The next thing after that whole big speech, I'm going to come right here. I'm going to drive my human elbow into your. Good. Now watch this. I'm going to hold this spot, and I'm going to call this windshield wiper. Did you see it looks like a windshield wiper?
Yeah.
So I want you to windshield wipe with your windshield wiper as I hold this horrible spot.
Ow.
Now how much does that hurt?
It hurts.
Okay, go slower with your leg.
Ugh.
Touch down. So touch your ankle down and bring the windshield wiper up. And touch down and bring the windshield wiper up. How much does that hurt? A
That
lot or
hurts
a lot?
A
Okay,
lot.
good. See, that's what you get for making fun of me. No, okay, so lift that leg up.
Okay, it's much smoother.
Much smoother. You're just saying that because you don't want me to do that again.
Yeah.
It's- All right, no, but try. Let's see, because I
Okay.
don't have to do the elbow.
Yeah, it's smoother.
I don't believe you. And what's with the calves? You also told me about your calves.
Yeah, they hurt at times. I don't know
Okay.
why.
So lie on your side, facing this way. You're going to put both arms on this side of the table.
Okay.
Let me take this paper away. Move closer to the edge towards me. And pull up this top knee like this, and this tucks right there.
Okay.
Hold my arm. Just this bottom hand. There you go. Double up the arm. And do you see how your knee is hitting the table?
Yeah.
I want you to move close enough so your knee will hang off the table. Drive that shoulder back. Roll the hips towards me. Did you feel all those?
Yes.
That was crazy, right?
Yeah.
Come this way. Bring your pillow with you.
Okay.
Good. Lie on your side again. So we're going to basically mirror image what we just did.
Okay.
So the right knee comes up. Move close enough to the edge so your hips have a chance to rotate a little bit.
Okay.
Drive these elbows back. Now this is the side of involvement. This is the
Yeah.
right side. That side that's been difficult to get some changes.
Oh yeah.
So that's a big one.
I heard that.
That was a big one. All right. So lie on your back again.
Uh-huh.
Let me take this pillow away. Scoot to the top of the table. Okay.
Okay.
You feel like that gets a little tight on
Yeah.
you? How was that?
Great.
Good. A little more. Is that okay?
Yeah.
Good. Let's go back down to the ankle. Scoot down towards me so your heels hang off. And then you can lie back down. Here, I'll give you a pillow so you're more comfortable.
Thank you.
You're welcome. Come another 2 inches, just so your heels hang off. So I'm going to start with the right foot, even though the left one was worse, right, for ankle stuff. Okay, so come in close. Let this relax a little bit. There it goes. Do you hear it?
Yes, I felt it.
Good. But it already popped. Did you feel that?
Yeah, I felt the pop.
That one's good already.
Okay.
Good. Lie face down one more time.
Okay.
You can put your hand, yeah. Do a spot in here. Big breath in and blow it out. Wow. Okay, lift this leg one last time. Tell me what you think.
Much smoother.
Much smoother. Okay. So I don't know if we cured it all. Probably didn't. But we did a good session. What do you want to look at today? What do you want to work on?
My lower back, and the pain radiates to my heels and my calf muscles. It hurts a lot.
Do you feel it every day or just some days?
Every day.
How do you recreate that? Do you have to like bend down to feel it? Or?
No, just even walk. It's constant hurting.
Come stand right now. And what if you kept your leg really straight and touched your toes? Do you feel it that way?
No.
Then do a little walking. Go over there and come back again. And do you notice it now?
No, it's as soon as I get up from lying down for a while.
Okay.
Like it hurts here into my sacrum or whatever,
Okay. Yeah,
and then
that's the
radiates.
And is it both legs or usually just one
this
leg?
one?
Left leg.
Yeah.
Okay. So let's get you to lie face down for a minute and let's take a peek at what we see, okay? So move back towards me and move your arms to a neutral position back here and lift this thigh up as high as you can and then put it back down. And then lift this thigh up and put it back down. This time when you lift your right leg, point to where you feel tension, okay? And I'm gonna move your stuff out of the way too, okay? I should have left it in the other room. Here it is. I'm just moving it under this shelf. And you feel it in the sacrum?
Yeah.
Okay, put your arms down. So I'm just gonna take a look at your leg length. The left leg's pulling short. Here, I'll put these shoes on so when you look back at the video, you could see what I'm looking at, okay?
Okay.
The shoes have a big white line and the white line should match up. So we're gonna put these on like this and we're gonna hold them together and the left leg's pulling short. So we call that a left pelvic deficiency. And I'm going to adjust into the left sits bone. The real name for that is called the ischial tuberosity. And so I'm holding this bone here and I'm gonna adjust into that, into the ligament, the sacrotuberous ligament.
That's where it hurts.
And then right in there, right?
Yeah.
It's right there. But let's go back and look at the feet. And I get the feet even. Now I bring the legs up to this position. Does that make it worse?
No, it feels better.
Okay, it's already feeling better. So let me check the sacral base. Yeah, the sacral base is high. So what happens is this is flipping up a little bit.
Okay.
So I want to push this back down and get on that. Now, how about now?
Yeah, feels good.
Okay, so watch this. We're going to do something else, okay?
Oh.
One more time. Good, got it.
Okay.
Now, that shocked you, right?
Yeah.
But feel how this feels like now. You see that? Now lift this leg up. And look how high it comes up. Now lift this leg up. It's already feeling a little better, right?
Yes.
Good.
Better.
You know, it's sitting at the computer too long without getting up more often.
Okay.
So if you're sitting working on the computer and 45 minutes went by, then you should stand up and move around.
Okay.
And then sit back down again.
Okay.
But even like sometimes you could just even look at the computer screen and just move. If you haven't, like let's say you're studying something or you're, contemplating something and you're not actually working and typing, you could just stand up for a minute and just kind of sway around and move and stretch your body and then sit back down again. Because we have a lot of time when we're just kind of staring at the computer and not being active.
Yes.
So remind yourself, well, get up a second and you can actively stare at the computer from a standing position.
That's right.
So I want to check this next. So hands on your lap. Yeah, so this is all tight in here. Do you feel how this is all tight? So I'm going to do an adjustment on this now, okay?
Okay.
So I'm going to I have to get a little higher than you for this one. So you're going to turn your head this way. I'm going to put your head right in here. Let the shoulders fall. Do you hear it pop?
Yes.
So now turn this way. Let your head fall this way. One more. Good. So now scoot back towards me. I'm going to take the arms like this. Put them up on your own body. Let me raise the table just a little bit. Create like a little roundness in here. Now lie on your back right here. Everything's popping on you today, right? Look this way with your face. Keep looking that way.
Oh.
Look this way with your face.
You're amazing.
There's more, right? So you're gonna help me sweep your hair through this, okay? I can't remember if you did this before.
No, I haven't. I think it's the new.
Yeah. All right. So we just want to feel a tug a little first, okay?
Okay.
Do you feel it stretching?
Yeah.
Okay, big breath in and blow it out.
Wow.
Where'd you feel that?
Right here.
More out of the neck.
Yeah.
You had more in the neck than you thought. Did it make a popping noise or just stretch?
A big popping noise.
Yeah. How does it feel?
Very good.
Good. So now you're going to lie on your side facing me this way, please.
And it also did something here.
It opened up the base of the neck and
Yeah.
around the scapulas gets tight from being at the computer all the time.
Yeah.
And texting.
That's true.
Yeah. Because when we text, our head's down.
Mm-hmm.
Bring this top knee like this. I'm going to put my hand through like this and get your low back.
Mm-hmm.
Good. Let me drop this down even more. Good. Go to the other side, please. What'd you feel on that one?
I felt it all here.
Yeah.
And even up here a little bit.
How many went?
Huh?
Like 10 of them.
Yeah,
right?
like 10 of them.
I think you're the popping champion today.
You're very strong.
Wow.
That was a lot.
That was a lot. Lie on your back, please.
Whew.
You all right? You're like, what the hell did I sign up for? All right, let's look at this one real close, okay? Got it. That was a loud pop. All right, those are good. Let's leave those, okay? Come stand. Come all the way over here. Let me check your wrist, too. So you turn this way. Your elbows go a little hyperextended.
Yeah.
Wrists are good. Ooh, that one went.
Mm-hmm.
What do you want to work on today? What are your spots?
Well, there's something where the coccyx bone slips up because I sit at the computer and it's all on this left side all the way down to my ankle. It's like numb, feels weird.
Okay. Does it hurt in any specific position, or if you're walking or standing or jumping or?
This hurts constantly.
Okay. Do you feel it right now?
Yeah.
Okay. Stand for just a second and turn with your back this way and point to the spot that you feel the most.
Right here.
Yeah, so you are pointing right at the coccygeal sacrococcyx area. Okay, so I'm going to have you start face down. Put your nose right in here.
Okay.
And I'm going to take a look. Good. And I'm going to move your hair off to the side. There you go. All right. So the first thing I noticed is this whole hip is like jacked up. So it's hard for you to lie flat almost, right?
Yeah.
Because it's off balance a little bit. Does one side hurt worse than the other?
Yes, this side.
Okay. So here I am on the edge of the sacrum. I'm coming down.
Right there.
And this is where it gets really tight. So that's the lower part of the left SI joint. And I'm going to roll this a little bit and see what that feels like. I'm going to rotate the leg, and then I'm going to rotate it this way. So I'm internally rotating it and externally rotating it and internally rotating it. We call this toe out, toe in, toe out, toe in. Let's look at it again. Now I'm kind of at the end here. I mean, the coccyx tucks under, so we're not going that far down. But I can be on the top of the coccyx and get a little bit of pressure and leverage in on there. But that hurts, right?
Yes, it does. A lot.
Okay. So there's a leg check that I know from the activator technique that's kind of interesting to see. The legs are even. And now squeeze your buttocks really tight. And look how the right leg goes short. And then relax your buttocks. Good. And here, film up so you see what she's doing too. Squeeze the buttocks and then relax the buttocks. Okay, so watch the feet again. So the feet are even. Squeeze the buttocks. Relax the buttocks. So as they pick the legs up, the left leg is longer, so it is a left deviation. And this is just a cool test. So I'm actually going to use the activator for this. Now, people watching will go, well, you know, you could do, there's manual techniques, but, and they've been around for a long time, but as much as people want like big fun things to watch on the video, you know, first I'm a doctor and first I'm trying to help patients. I'm not trying to create crazy wild videos all the time. Sometimes I am. I'm on the left cornu of coccyx, a little horn, a little cornucopia horn of coccyx. I'm going to put it on a fairly light setting because it's not a big structure and adjust it. Good. Let's go back and recheck. So come down here and look at the feet again. So we know the feet are relaxed, and now squeeze the buttocks tight and relax. Squeeze the buttocks tight and relax. So I took the pressure off that nerve already. Now I also want to see if we have a deviated sacrum. So I'm going to bring the legs up to position 2, then bring the legs back down. I'm curious to see what happens. But come sit up again. Because I'm going to look at your neck anyway when you're sitting in a seated position. But see what the coccyx feels like now.
I feel like you relieve pressure.
Yeah, I mean, I moved it off. The bottom of the spinal cord, so the spinal cord, you know, starts all the way up at the top here by the brain, right? At the brain. And it comes all the way down. And then by the time you get to the lowest part of the lumbars, it turns into like these long, stringy tendrils, right? It's not so much a cord anymore. And it's also named in Latin, cauda, which means tail, and equino, which means horse, like horse's tail. So it literally looks like a horse's tail. And those tendrils anchor all the way down to the coccyx.
Yeah.
So when the coccyx is deviated or disrupted in any way of its normal position of ease and alignment, it's going to put a lot of pressure on the whole spinal cord.
Okay.
And it can even give you a headache.
Yeah, it does. It gave me even through my neck.
Because the cerebral spinal fluid, and there's just a few, you know, ounces or cc's in the brain, but it comes down the little shaft of the spinal cord and it repumps back up, like on a hydraulic system, back up to the brain. And so if the coccyx is disrupted, it literally can cause pressure and a disequilibrium of the state of homeostasis of the cerebral spinal fluid, and in effect give you a headache.
Yeah, it did.
Or compound a headache.
Yeah.
So how do you feel right now?
I feel like pressure has been relieved.
Okay, so that's all I did was just tap the coccyx on a very low pressure setting. Didn't look like much, but I probably helped the patient without being invasive. Like I didn't have to have her take her clothes off or touch her in any way, make you feel uncomfortable. So I feel proud about that.
Okay.
You know, to do as little as possible, but also to be effective. All right, so we're gonna do this one next. Maybe move your hair all the way to one side like this. And I'm going to stand behind you. Scoot forward a few inches. And I'm going to turn your head all the way this way. And drop my arm this way. And you're going to bring your head over the top like this. Let the shoulders sag. It's a little bitty one. Did you hear it?
Yeah, I did.
Didn't make a loud one, but didn't you hear one?
Yeah, it did.
This one's going to be louder because this is where you have all the pressure.
Yep. Felt it. Feels so good.
Okay, good. So now lie on your back.
Yeah.
Scoot down this way just a little bit. A little more. Good. So now lie face down, please.
Okay.
Move the hair off to the side again. Thank you. I'm going to grab the skin here, okay?
Okay.
Those are all good. Drop your arm. Big breath in and blow it out. It still feels tight in here. Okay. Lie on your side, facing me this way.
Facing you? Okay.
Straight, straight. Right there. Hold on tight.
Okay, sorry.
Got it. Drop the knee down now, towards the floor. Like this.
Oh, sorry.
You're just going to point the knee towards the floor. Got it. One last one. Come this way now.
Feel it.
So trying to release pressure all in that pelvic area, the
Yes.
sacrum. Lie on your side. We're going to mirror image to this side. Do the same thing again. Bend the top knee up like this. Pull this through. So now we're going to go back in and do the same thing again. Let me put my arm through. And you will hold on to that tricep. Bunch my hands there, okay?
Okay.
That's it. Got it. Wow.
That's it. Yeah.
Lie on your back. How did that one feel?
Much better.
Good. I'm curious to see how that pressure feels over the next 48 hours. I think it's going to take about 48 hours.
But I feel like an instant relief.
You did?
It was constricting all the way, like you said, all the way to my brain.
Well, good. So I'm going to do this ankle first, okay? Got it. Firm, good. Until your head back, hold your arm firm, good. Keep it firm, make it strong, good. Now tilt it down a little bit and make your arm firm, good. So relax your arm a second. So I just checked her in a couple of neutral positions, like neutral forward, extension, flexion. Now we're gonna go into the side of pain. I'm gonna laterally flex. Laterally flex is just sideways, it's ear to shoulder. So don't rotate, just come straight this way, like that. Now hold your arm up and keep it firm. And it can't, because this is compromised on this side. And she knew that, but I just want to see so that I have a before and after I work on her. So now we're gonna bring it this way, and that opens up the facet here, that opens that up, and hold strong. So that side shouldn't be a problem. So when we close the facets and make them worse, make them more crimped, more pinched, more compressed and pressurized, then she loses power on that side. So first I'm going to just massage into the muscles just a little bit, because this feels like a piece of concrete. And you feel this too. You probably have rocks here all the time.
Yeah.
And she's athletically very supple. And that's what we really want in a muscle. When you're not using a muscle, we want it to be taffy-like. We want it to stretch and be supple and be like more like clay or taffy. But sometimes a muscle that's been irritated for a long time feels like a piece of rawhide or beef jerky. And sorry to call your muscle like beef jerky, but that's what it feels like on this side. But the good side is no problem. Look at that. Yeah. That's beautifully supple, like a muscle should be. A muscle not used should be soft. And so I'm just digging this out, digging this out, digging this out. And I'm going to stretch a little bit too, okay? So I'm stretching and stretching. Good. So now I'm going to motion into these joints. I'm not adjusting yet. I'm just getting it supple and ready. Right in there is so bad. Do you feel that? That's one of the worst spots. So this is a harder to get adjustment because it's through the trap. Like there's much more exciting pops I can get up top where I would just crack and you go, wow, I heard the crack and it's amazing. But it's not the spot that needs it. The spot that needs it is really low. It's down here at the base of the neck. Well, let's see if it does release, okay? Yeah. Take a breath in and blow it out. Check that, okay? I don't expect it to be healed, but let's see if we get some of the power back, okay? And we're gonna redo it. First, we're gonna test you neutral, just to see what that arm feels like. Good, so we know we have a strong arm to begin with. Now we're gonna laterally flex it to the bad side and keep your arm strong. Hold. Big difference already, right? So now we're gonna laterally flex, rotate, and bring it back, which is coupling the worst segments. Hold. And it's not quite better yet. So the next thing we're gonna do is right in here. So turn around. She still has, so we got part of it already. And to be honest with you, that's really bad. So to be honest with you, we might need a few visits on her, but let's see what else we could do, okay? So right here is the first rib. I'm feeling that rib come right out of the T1 area, and I'm gonna use this instrument, and now come up higher towards the neck. Okay, good. Now we're gonna laterally flex, bend, and take it back. Hold your arm. That's nice. So that's good for a first visit, if I do say so myself.
So
what do you think, Ella?
So much better.
Yeah, it's cool,
Like
right?
rotation. It's still obviously it's still got a little bit up here, but
It needs work, but this is
works.
fixable.
Yeah.
And you know, I would say, you know, to come do a few treatments if you're interested.
Yes.
But you're gonna do fine. You're gonna go
Like that.
really rapidly. You'll probably feel by tomorrow you'll probably be 60-70% better from one treatment.
Exactly.
Because you're already in great shape. You just have that one spot that has
I
like,
popped this out years
yeah,
ago.
it's just really bad. But your shoulder blade's out too. So we have a few more fun things to do. I'm gonna have you lie on your back here. You're gonna be close to this edge because there's more to that
The shoulder
complex. That, well, underneath. This is out also.
Yeah, because I broke my arm through here.
Is it? Yeah. So I saw that already. No, stay flat on your back. And I'm going to keep your fingertips here. I'm going to put my hand in like this and sneak my hand under here. And you can feel that set.
Yep.
So it's another part of it.
Mhm.
Now I'm going to have you lie face down again. Well, I didn't have you lie face down yet.
No.
But I'm gonna have you... Lie on your side facing me, please. Move close to this edge. Put your hand up here like this. I'm going to stretch this leg straight and this one bends. I'm going to put my hand under here and I'm looking for the lumbar. Right in there. That was cool.
That was great.
Come this way. Come closer to me. Switching arms. Hand goes in. Pulling up the knee. Let that fall again. Where's one more? Let it roll towards me. Can't?
No, it's tight here.
Okay, so let's leave that one. Scoot over this way. 1 second though, you do have 1 or 2 pieces to work on. Yeah. So lie face down now. I'm gonna have you lift this thigh off the table as high as you can and put it down and lift this thigh up as high as you can. Which one hurts more?
This one at the moment, I think it's just muscle.
Yeah. So I'm gonna lean into that with my elbow, okay? Now start to lift that right leg up again, okay? I know, but just do an inch or two and then put it down and lift it up a half an inch and put it down and lift it up a centimeter and put it down and one more, lift it up. There it is. That's what I was looking for. So one of the things that we do when you're in the office on a regular visit, sounds like I'm selling you something, but we have a 10-minute station before you see me where you get all this worked out with the hypervolt. Yeah, and that really is a nice addition, especially in you that has these tight glutes. But I'm hitting it a little bit right now.
Yeah.
And I will hit it for a few seconds on the hypervolt to give you that experience. I know you know the hypervolt, but it's fun to have someone do it to you rather than reach behind you, try to do it to yourself. That's the lightest setting.
Oh, that's so painful.
Now, sometimes we add rotation with it, so we floss the muscle with it at the same time. But you need a lot of work with this, okay?
Yeah.
So now lift that leg by yourself. How does it feel now?
Better.
Good, so lie on your back. So all the stuff that you have is fixable. The neck is a long-term chronic thing, but it's still fixable. And I'm just gonna look at the last thing. I just wanna see what your feet look like.
Some issues, neck, mid-back, lower back, legs, right? Tell me about your issues. So what's going on?
I was a very excessive worker in my younger years. I wasn't fortunate to have a lot of things, so I worked a lot. I did about 2 or 3 jobs at a time usually, and apparently it just put a lot of strain on my back. I just recently found out about a year and a half ago, I want to say, that I suffer from a deteriorated disc, which causes me another issue with pinching on my left sciatic nerve. And that runs the pain all the way down into my left leg, which is also not any fun because I've had 2 knee surgeries on that leg as well. But it bothers me a lot. It's really numbing. It's paralyzing even at times. Very hard to move, very hard to get up out of the bed. But you know, you do the best you can. I try to do as much therapy on it as I can, but it's really a consistent issue that I deal with.
Basically, we went over the x-rays and, you know, mainly the degeneration is in the L5, S1 level. And because of the level of degeneration, you know, there's a limited amount of things that we can do because once we can't really bring the disc back, basically,
yeah, of course,
you know. Yeah. So that's why most of the time they'll suggest surgeries, infusions, and so forth. Okay, so that's why we usually tell people to come in and get chiropractic treatment so they can keep their range of motion and keep their mobility at a stable level. Okay. You know, so really chiropractic care is mainly preventive. You know, although it does help as far as, you know, when you're having your aches and pains and so forth. So today we're going to do a few things to kind of assess and see what's going on. Okay. All right. And then we'll do some chiropractic adjustment for your whole spine, neck, mid back, lower back. Okay. And then we'll put you on different types of treatments like massage to kind of help with the muscles. So I'm going to have you bend forward, try and touch both feet, and let me know at what point you start feeling aches and pains. Right about there. Okay, gotcha. Yeah. You feel anything shooting down, like for example, like any radiating pain down the leg or anything like that?
It's more of like a strain.
Gotcha. Come on back up. Come on back up. All right. So let me have you go side to side and let me know if you feel any aches and pains or any radiating. So you're gonna go this way and that way.
Yeah, that's there.
That's as far as you go with that. Okay. And let's go to the other side. That's as far as that actually feels good.
For the other side.
Gotcha. All right. The neck and upper back is not too. They're not too bad, right? It's mainly the lower.
Yeah. Any pain I may get in my upper back will just like kind of be a little crampy pains if I'm laying a certain way or whatnot.
Gotcha.
But not as bad as my lower at all.
All right. Let me have you kind of extend a little bit. I know extension is uncomfortable for you. Is that tight in the mid back?
Yeah.
Yeah. Okay. All right. Okay, that's uncomfortable. All right. Now let me have you bend forward. How's that?
I don't have much strength there.
Okay. All right. Let me have you go backwards. All right. That's still uncomfortable, right?
Yeah,
All right.
it's like pressure.
So I'm gonna add a rotation component to it. So I'm gonna have you cross your arm like this for me. And then I'm gonna rotate you and then bring you back. And then let me know if you feel any relief or if you feel, aggravation. That's uncomfortable because you're resisting me. So, all right, okay. And let's rotate this way. And let's bring that back again. That's uncomfortable and sore as well.
Yeah, and not a lot of strength to hold myself up.
Okay, all right, you can cross your arm. So relax.
Yeah, I feel a little nervous, but
you'll be all right.
I'm a G, I can handle it.
Good. Good.
Wow.
All right, come on up. Let's see how that feels. Good. Move your neck around. Let me know how that feels.
That feels great. I'm even just saying it. It feels great. I've been so stressed. Wow. That's all it took?
Feels amazing, right?
But don't try it at home.
Right, yeah. So they gotta be licensed.
Leave it to the professional.
Is that comfortable for you?
Mm-hmm.
All right, so what I want you to do is relax for me, okay? All right, so I want you to relax, okay? Good, okay, perfect. All right, let's go to the other side, do the same thing. Relax. Good, okay, all right, come on back up for me.
Uh-oh.
It's okay, I'll fix that, yeah. Let me help you up there.
Ooh.
Okay, just kind of like move around again. Let's see how you feel. All right.
Feels a loose.
Right.
Yeah.
More range of motion, right? Okay. All right. Take a deep breath for me and blow it out. Out. Good. Again, deep breath. Out. So I'm gonna fix you up. I'm gonna bring you close to the end of the table. Keep coming, keep coming. There you go, good. I'm gonna twist you up a little bit. Good. And I'm gonna bring your shoulder right here. So keep coming closer to the end of the table. Keep coming. Good. You won't fall off, so don't worry.
Okay.
All right. Good. All right. Just relax as much as you can, okay?
Okay.
Relax. Oh, there we go. Felt it, right?
Yeah.
Yeah. Oh, one more time. There you go.
Oh, wow.
Wow. You got all kinds of movements now that you didn't have before, right?
I know, you heard that.
Yep.
I'm like, oh, wait. Oh, boy.
Yep, there you go.
Yeah, that felt great.
It's like instant.
Yeah.
No. All right, both legs straight for now. And I'm gonna bend this leg and go all the way. There you go, good. Good, so I want you to relax. Good. There you go, perfect. Yep, that's it. You felt that, right? Yep.
Yeah. I already feel so much less stress.
Okay.
Like
Let's have you move around for me. So stand up. Let's have you move around. Tell me how you feel.
How auntie look, shy? Oh, good.
Yeah. So that's much better, right? Yeah.
That's a lot better. Wow. I feel even a tiny bit more strength in my core.
Right.
Obviously not, I don't think the strength is going to build up now, but it's allowing me to be it because one of the reasons I don't do a lot of core exercise because it's extremely hard. It's painful. I don't even have the motion, you know, or just the strength to try to sit there to start the process of it. This is at least allowing me, you know, to
move a little bit better,
move and yeah.
Let's go side to side
awesome.
now. Remember, side to side was a bit uncomfortable, so let's try going side to side and see how that is. All right. So you're moving a little bit better. Still a little tight, but it's better than before, right? Yeah. Good. Now the main one was extension. So when you went backwards, it was uncomfortable. So let's just try it.
Oh.
Okay. How's that? A little bit better.
It's a bit more tolerable.
Gotcha.
Yeah.
Okay. Perfect.
There was a lot of tension in my back neck area, a lot of it, and honestly, it's all gone.
That's good.
It's really all gone now. It's been very tight. And I try to sit at home and massage it with some rubbing alcohol, thinking that'll help loosen it up, but it doesn't really work as well as I now see it should.
Trying your own home remedy, I guess, huh?
My grandmother told me that a little rubbing alcohol, and then I'll follow it like a little icy hot or something.
Well, chiropractors out there, though. So I'm gonna examine you first, okay? I just want to see like what type of movements you have, what's causing you pain, and your progression basically. After the assessment, I will do some adjustments, but it's probably gonna be limited to certain things, given the history.
I'm just good. You're gonna pop me. You're gonna do me just like you do everyone.
Like I do everybody else.
I want the full things. No, I'm not getting that. No, I want it all.
Yeah, but we gotta make sure that it's safe, though.
We good. We good. Last time you told me no. This time you gonna give me.
Yes. All right. So let's examine you first, and then we'll go from there. Okay. Let me start with actually start with a lateral flexion. Let me know when things starts to get tight or uncomfortable for you. Not too bad?
No.
Not too bad. Let's go to the other side.
Stop trying to do me like I'm a baby.
That's okay? Okay. Let's have you go forward for me there. Okay. Let's have you go backward. Okay. All right. I'm going to apply a little bit of pressure. That's fine? Pressure. That's fine?
Yes.
Pressure. That's fine, right? And I'm going to bring you back. How's that? That's okay? Okay. Let's have you rotate again. Good. Let's bring you back. Extend. Okay. That's not too bad?
No.
Okay. So you're actually doing your progression is really good. Apply a little bit of pressure here. How's that? Is that okay? Okay. That's okay?
Yes.
That's fine. Okay. This is fine. Okay. Let's lift this whole leg off the table. So bring it up for me. Keep it straight. There you go. And bring it down. All right. What did you feel with that? Was that okay?
Yes.
Yeah? Same thing on this side. Lift the whole leg up. Bring it down. Okay. What's going on with that? What did you feel? Tension in the lower back?
Yes.
All right. We're going to do that movement again, but this time, when you lift the leg up, I'm going to press down and you resist, okay? Don't let me push it down. You understand?
Okay.
Okay, so lift the leg up, all the way up. I'm pushing down, resist. Okay, let it go. Was that uncomfortable? I hear you straining a little bit.
Yeah, I had to relearn how to walk again. I got some strength,
but it's getting there. Okay. Yeah. All right. Same thing on this side. Lift. I'm gonna press down. Okay. Let it go. All right. It's a little bit of weakness, but it seems as if it's getting better though.
Yes.
Right? Let's have you bend forward. So you're gonna bend, try and touch both feet, and you let me know what you feel. What's going on? Okay. Come back up. What do you feel? What's going on?
I feel it here.
You feel it in the lower back?
And then
the top. Okay. All right. I am going to do 3 adjustments, okay? I'm going to do adjustments for your low back, for your mid back, and then for your neck, okay? You will not get the Y strap, okay? You know what that is, right? That's
yes,
no, we're not doing that. The reason why is because you had an injury, you know, and given the history and things like that, you know, it's not recommended because it's just too aggressive. Good, relax, relax, relax. Yes, man. That was good.
Yes.
How did it feel?
I feel refreshing.
Refreshing?
Yes. I felt the tension lift from the back.
I see. So less tension.
Yeah, I have been having pain like in the back, like when we tie our scarf. I thought that it was from the scarf, so it's from there. Okay. Yeah, okay, come on next.
Go on next, right? Okay, relax. Let everything go for me. Good. Relax, relax.
Ooh. Fuck.
Ooh, that one was really loud. How do you feel?
I feel good.
You should feel loose.
Yeah.
Yeah, like, you know, like you're melting, right? Okay, that is it. So basically you got 70% of whatever, you know, the folks that you see, you know, the other 30 we can't do, okay?
Yes.
Get up, move around for me, let me know how you feel. You should feel loose. Oh, okay, you're showing off now, right?
Yeah, I'm good.
Not too bad?
Yeah, I'm good.
Okay, have a seat. All right, so the next thing we're going to do exercises that I want you to do. We're going to do some stretches, and I'm going to show you certain things to do at home, okay? That's usually the part people don't like, because they don't like to exercise. And then after that, we're going to do the massages. Shakona will take over. That one people like. So most people, they like that, the adjustments, the cranking, and they like the massages. They don't like to exercise. But the most important part, actually, is exercising. You know, to strengthen your muscle, you stretch to kind of relax the muscle. That way you don't have to come to me and pay me all this money. There you go. Perfect. What you want to do is lift the lower portion of your bottom upward. Good. And then you want to go up and down motion. Very slowly, though. There you go. Good. There we go. Perfect. Good. Good. How does that feel?
It feels good.
It's not like super comfortable, but it's not meant to be super comfortable, right? It helps decrease tension. All right, you can go ahead and come up. And what we're going to do, look, your glutes, your bottom, try to make them touch your heel, okay? All right, good. And then what we're going to do is kind of like lean forward and slide. So deep breath, out, slide forward. There you go. Good. Okay. Now
you're gonna help me get back up.
We're gonna help you get back up. We're gonna do that again, but this time you want to try and keep your glutes down while you lean forward. Lean back. Good. And you want to slide forward. I know you got too much, right? Yeah. Let's lean forward. Good. Take a deep breath first. And lean forward for me. There you go. Good. Slide. Try to keep the bottom. Yeah, there you go. Perfect. Yeah, now it becomes a bit harder, but at least you're targeting the area that you need, okay?
Yes.
Let's have you come back up. Okay. On all fours again. And so the motion is inward, outward. So I'll do it first. So what you want to do is head down, bring that upper body upward, okay? So it's more like stretching. So down. There you go. Good. All right. And then the opposite motion. Nope. You keep your arm straight. This goes inward. Lift the head up. There you go. Good. All right. So it's kind of like this motion, that, and that. Okay?
Okay.
All right. So let's do that one more time. Good. Head up. Good. And then after that, we're going to go the opposite. So, and there you go. Perfect. Okay. I want you to relax. You can drop the leg. I got it. Okay? I'm going to bend it. Good. And I'm going to go ahead and stretch you out. just relax for me. Good. There you go. Perfect. If it gets too tight or too uncomfortable, you let me know, okay? All right, just go ahead and relax. Deep breath. And go ahead and let that out for me. There you go. Perfect. Good. All right, nice. Okay. And that's the key. When you're stretching, you want to try and relax, even though it may be a bit painful, okay? All right, we're gonna do that again.
Okay.
There you go. Good. And actually, I have to go the opposite arm. All right. There we go. Good. Okay, perfect. Okay. Relax and give me this arm. Good. There you go. Good, good, good. Relax. Yeah, relax. Good. Okay, we're gonna do it again.
Okay.
But try your best to just let everything go, okay? Deep breath. Deep breath. And let it out. Relax your body. There we go. Good, 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 good. Yes. Perfect. Okay. Good. How was that? Not too bad?
No.
All right. Good. Yeah. There we go. Good. It's a good stretch though. It gets both areas. Give me the hand. There you go. Good. Deep breath. And out. There you go.
Goodness.
Yes, ma'am. Yes, ma'am. All right. How did that feel? Not too bad?
No.
Okay. What we're going to do, reach for both feet for me. And I'm going to go ahead and bring you forward. There you go.
Oh,
Yeah. There you go. Nice. You should feel it here and you should feel it here.
Yeah.
Okay? There you go. Nice, nice. Right there. Perfect. Good. Uh-huh. Mm-hmm. Good. Yep, yep. All right. There you go. Perfect. And go ahead and let it out. There we go. Nice. Good. Perfect. Good. Let's go one more time. I'll tell you when. Deep breath. And go ahead and let it out for me. There we go. Nice, nice. Good. Okay, perfect.
Just squat that hand. Spirit finger. That's right, Shaquana. Go ahead, get in there. Go get in there. Oh. Yeah. Then, yeah, Shaquana. Push that button. Push that ass. See, this is why you are the best chiropractor. There's not too many chiropractors that does the adjustment and does the stretches and the massage.